My screen. Hi everyone, my name is Moriam Khanam and I'm a PhD in health candidate. I'm in the third year at Dalhousie University. My PhD thesis is looking at the health of immigrant and non-immigrant children and the impact of social policies in Canada. Canada ranks behind many high-income countries in terms of overall child health and well-being. In addition, the social determinants of health is unequally distributed across population groups that leads to inequalities in child health. Social policies like child benefit and child care policies can shape the health and health inequalities of children by influencing their social determinants of health. Although immigrant children represent a significant and growing proportion of the child population in Canada and they face greater socioeconomic disadvantages than non-immigrant children, there exists limited evidence on the health differences between the two groups and how child-related social policies influence their health. Therefore, the objectives of my research are to identify inequalities in health between the two groups and the factors that explain them, and to evaluate the impact of the Canada Child Benefit and the universal child care policies on the health of immigrant and non-immigrant children. It is noted that the Canada Child Benefit was introduced in 2016 by merging the existing child benefit programs, and this new policy change has substantially increased the benefit amount for children, especially from low and middle income households. On the other hand, the universal child care was a highly subsidized child care that was introduced in 1997 in Quebec that made $5 per day fee for child care. For my research, I'm using 4 Statistics Canada datasets that I can access through the Atlantic Research Data Center, which is a part of the CRDCN and located at Dalhousie University. I'm using Canadian Health Survey on Children and Youth, Canadian Community Health Survey, Canadian Health Measure Survey, and the National Longitudinal Survey of Children and Youth. Using the Canadian Health Survey on Children and Youth, I am applying Oaxaca-Blinder decomposition to assess the health inequalities between immigrant and non-immigrant children. This approach shows how the health of immigrant children would change if they had similar observed characteristics like non-immigrant children. With the other 3 datasets, I'm using difference in differences approaches to compare the health of exposed children to the policies with non-exposed children before and after the policy changes. I do have some results from my first objective, that was measuring inequalities and explaining it using the Canadian Health Survey on Children and Youth. Here, the table shows the descriptive statistics of the outcome variables, and for most of the indicators, immigrant children have better health status, except for body mass index and overweight and obesity, which are higher for immigrant children. Here are the results from the Oaxaca-Blinder decomposition. So this graph shows what would have happened to immigrant children's health if they had similar characteristics that are observed for like non-immigrant children. This graph shows that if immigrant children had similar equalized household income, safe neighborhood, and parental working status like non-immigrant children, their health would have improved further. Now I'm working on evaluating the health impact of the 2 policies, that are child benefit and child care policies, on the health of immigrant and non-immigrant children. This research together will generate evidence that could be useful for better understanding the health inequalities and the health impact of child-related social policies in Canada. Thank you for listening, and I'm happy to take any questions. And I would like to thank CRDCN for this opportunity to present here.
Thank you. Thank you so much for your presentation.